Hello again, everyone. My name is Marty Guthmiller, and I am CEO at Orange City Area Health System, bringing you today the 49th edition of the COVID-19 Community Briefing. As it is a Monday, I do have a local scoreboard to go through. And keep in mind, these test numbers are going up in terms of the tests performed as well because of, in part, our relationship with Northwestern College. And so all of these numbers throughout the county are now being reflected through all of our college testing, including at Dordt and Northwestern. So our local scoreboard, 137 positives of 1,680 tests. We do have eight tests pending, and that's an 8.15% positive rate. In Sioux County, we have 780 positives. Of the 5,166 tested. That is a 15.1% rate. That is an increase from 14.3% when we spoke last week. Region 3, again, I'm going to talk a little bit later again about positives and the acuity level, as I have all along. Those are the two metrics that I look at. Region 3 metric, which is a pretty important one for me, deals with hospitalizations. There are 29 currently hospitalized in Region 3, 20 counties in Northwest Iowa. That number when we spoke last week was 38, so we had a nice drop there. 6 in the ICU, that number was 8 last week, and 4 were admitted in the last 24 hours. Again, all of this information can be verified or looked at on your own at coronavirus.iowa.gov. Regarding Region 3, again, the point there is there's plenty of capacity. There are apparently 101 ventilators in Region 3. 99 of those are available currently. So clearly a capacity in a number of different areas that we were very concerned about back in March. Iowa as a state is at 56,586 positives of the 597,555 tested. So we're nearly at 600,000 tests in the state of Iowa. That's a 9.5% rate across the state. That has gone up slightly. It was 9.4 for a long time. We're now at 9.5% positive. More hospitalizations, and this time on a statewide basis as opposed to Region 3. We're looking at 263 hospitalized COVID-19 patients as of just a few minutes ago. That number when we spoke last time was 278. So a slight decrease there of 15 patients in the state. Closer to home, and perhaps more importantly for us, Sioux County, 3 hospitalized COVID-19 patients, O'Brien County, 1, Plymouth County, 2, Lyon County, 0, Woodbury County, 8. Polk County continues to be number 1 in the state with hospitalizations at 49. We've had additional deaths in Iowa. That number is currently at 1,039. We've maintain the same number of deaths in Sioux County at 3. And when you look at the trend line on the death graph, it is trending down over the last week. When you look at the next stat category, percent positives, 14-day average, that has gone up for Sioux County. We're at 14.6% in Sioux County. That is currently 7th in the state. And we were at 11% before. So those are the statistics for today. I'm going to talk a little bit about a couple of the other things that have been out there and are currently just a topic of discussion, quite frankly. The first thing is masking. I think it's important that you understand the official position of Orange City Area Health System, and that is one of universal masking. We have a policy of universal masking. We do require that in our patient and provider encounters. We require that in the hallways. And so you need to understand that that is our corporate position. We do have 574 employees, give or take, from 43 different communities. And so their personal lives are their personal lives. And while we model, we ask them to model the behavior that we feel is responsible, and I'll talk about that in just a little bit. It's an unrealistic expectation to expect that we can control the personal lives of that many people, even if we wanted to. Really personally, from my perspective and my own self, I choose to mask most of the time, but all of the time when I can assure myself of the 6 foot, 15-minute rule. Again, I mask most of the time. I mask all of the time when I can't guarantee myself, assure myself of the 6 foot, 15-minute guidance. When I mention grace and when I talk about grace in our lives, I do so for mask wearers to non-mask wearers, but also vice versa. It's bi-directional grace, not one-directional grace. I just want to talk a little bit about the narrative change that we've observed and all been a part of over the last 5+ months now. In March, if you recall, we were all about flattening the curve. We're all about slowing down the spread of the virus to preserve hospital capacity and personal protective equipment for people that cared for people. Social distancing and mask wearing measures were largely successful in flattening the curve. But keep in mind that the goal, that narrative, was never to avoid any and all positives. It was to slow it down. Dr. Donlin, in a number of his talks to us here and personally, talks about setting realistic expectations. Well, in August, we find ourselves in a world where, as an example, one positive at Buena Vista University made the nightly news as a matter of news, of one single positive coronavirus case. How has this kind of narrative changed our perspective? Is it an unreal expectation to do everything to avoid all positives when acuity levels are remaining low? So in addition to monitoring percent positives, please consider factoring into your equation the acuity level of these positives. Again, as has been consistent with me from the very beginning, the most accurate measurement of how sick people are getting is at what level they're hospitalized. It's pretty hard to fake a hospitalization. And if people aren't hospitalized, they probably aren't very sick. And so I think it's a very good measurement of how sick people are getting. And I'd ask you to consider that as you move forward in your decisions. This virus will likely be with us for a long time, and we're going to need to adjust to that. Thankfully, though, new therapeutics and new treatments are in play today. Vaccines are on the horizon. But the new treatments are evidenced by, in part, some of the lower acuity levels as well. The lower hospitalizations, the shorter hospitalizations, the lack of dependence on ventilators has all been a tremendous movement forward since March. And so we can all be very grateful for that. Speaking not just from Orange City area health system, but from all the neighboring hospitals, certainly in Sioux County and around the area, Sioux Falls and Sioux City, we are all here to take care of everyone. And we're prepared to do that. We have better treatment regimens to do that. We are here. We care, and we will take care of you. And we want you to know that. I think I'm going to stop for the day. I want you to always remember to stay strong, stay vigilant, and above all else, stay healthy. I will see you again later in this week if you're of interest for the 50th edition of our COVID-19 community briefings. Thank you for joining us.